If your hairline looks like this, do not ignore, because there may be hope that ultimately it may look like this. In the next 3 minutes, I will show you our patient's hair growth journey. It is from day 0 till 6.5 years of hair growth. And the biggest mistake people often make casually, I will also explain. So please watch the video till the end. Our patient tried everything: oils, serums, shampoos, social media hacks, online things before coming to us. But nothing helped. The frustration kept on increasing. He started avoiding social functions. He had a pathetic self-image and he wanted now a better solution. He had started facing a receding hairline since 2012 only, when he was around 18-19 years of age. And now when he is in his late 20s, he wants a solution. Hi, my name is Dr. Preeti Saraswat. I am an American board certified hair transplant surgeon, and seeing around 1,000 patients of hair loss for past many years, we are now trying you to educate regarding your hair loss problem. So do not forget to subscribe this channel if you have any hair loss related queries. So when you walk in for your consultation for hair loss, what really matters is that the doctor and the patient are on the same page regarding why you got this hair loss, what is the diagnosis of your hair loss, then what is the long-term treatment planning, and you go according to that. We tell you the importance of following the medical treatment, the surgical hair transplant treatment, whatever is required, along with other therapies like PRP therapy or mesotherapy or GFC or exosomes, whatever is required. So you see, planning is most important instead of rushing into any kind of procedure. Also, because you've lost your frame of face, as you see in our patient, he lost his temples and he had a thinning throughout. It is important that we consider which areas are to be transplanted and which areas we have to wait for medical treatment to act. So in this patient, you will see that in 2,960 grafts only, we were able to achieve what the patient wanted. You can write in the comment section below why you are delaying your hair loss treatment, if you are. So you can see on your screen now the trichoscopy report of our patient, in which you will see that donor area is comfortable enough that we take the required number of grafts. The graft thickness is fine. So for him, we chose the follicular unit excision method, the FUE method, in which we cherry pick the good grafts to be transplanted in the receding area. He was given a local anesthesia with a vibration device and very fine needle, so that he feels very less pain, if at all. And after the ring block is complete, the procedure is virtually painless. So your safety, your planning and precision is all we need. Please check the picture of our patient on the day of surgery. You may like to appreciate that he has lost his temples and thinning of hair is throughout from the front till the transformation zone in the crown. So we did not do the whole of the scalp. We planned to transplant the front area and some part of the top of the head, so that we could achieve his frame of face and good hair in less than 3,000 grafts. Why? Because suppose he loses more and more hair later on, we have some grafts in our hand so that we can help him later on, maybe 10 years down the line. So you see his results now, 11 months after surgery, 1.5 years after surgery, and this one is 6.5 years after surgery. And listen to what he himself has to say now.
मेरा नाम रोमेश सिंह है। मैं मथुरा के वृंदावन से रहने वाला हूँ। मेरा हेयर लॉस जो लगभग 2012-13 से स्टार्ट, मेरी ग्रेजुएशन के समय, इंजीनियरिंग के समय स्टार्ट हुआ था, तो धीरे धीरे 2017-18 आते आते मेरा आगे से काफ़ी हेयर बॉल्ड हो गया था। मैं कैप लगा के रहता था ज़्यादातर। तो सारस्वत हॉस्पिटल के बारे में, मेरे एक भांजे हैं, उन्होंने यहाँ से हेयर ट्रांसप्लांट कराया था, तो मैंने यहाँ आके डॉक्टर साहब से विजिट किया कि मुझे क्या हेयर ट्रीटमेंट लेना चाहिए। मैंने उससे पहले काफ़ी हेयर ट्रीटमेंट लिए थे, लेकिन कोई रिजल्ट नहीं मिल रहा था, हेयर लॉस हो रहा था। डॉक्टर साहब ने बिहेवियर काफ़ी अच्छा था, तो मैंने उनसे सजेशन लिया, तो उन्होंने कहा कि आपको ट्रांसप्लांट कराना चाहिए और उसके बाद में इलाज कंटिन्यूस करना चाहिए, कुछ जो भी है। 2019 18 फरवरी को मैंने हेयर ट्रांसप्लांट कराया था। आज लगभग 7 साल होने को हैं। मेरा रिजल्ट अच्छा है। बीच में 4-6 महीने के बाद एक आध महीने PRP या 2-3 महीने का ट्रीटमेंट साल में 2-3 बार एक आध बार लेता हूँ, तो बैकअप ट्रीटमेंट चलता रहता है और आज मैं अपने रिजल्ट से हैप्पी हूँ। रिजल्ट अच्छा है मेरा। थैंक यू डॉक्टर साहब।
Please like this video if you find this information valuable. So here I would like to say that there is no right or wrong when you should get your transformation done. Whenever you feel bad about your self-image or you feel there is something missing, you should should consult your doctor and get your treatment done, whatever is required, whether it is medical treatment or it is surgical treatment or hair transplant. It is upon us, upon the doctor to decide for which candidature you are perfect. If you want a hair transplant consultation with us, you can call us on the numbers below or WhatsApp us your pictures so that we can book consultation. Do share this video with your family and friends who are undergoing hair loss or who want some guidance in this matter. So if you want to identify for yourself in which stage of hair loss you are, you can click the video on the left, and to know the cost of hair transplant, you can click the video on the right.